Welcome back. We're going to talk about CCM and RPM, chronic care management and remote patient monitoring. And here to help me do that is Ms. Shannon Riddell, who is our Population Health Director at Family Practice Associates. I got it all out right, I think.
Yes, you did.
And Eric Gilliam, who is Visium HealthLink President, correct?
Correct.
All right, welcome guys. Well, Shannon, tell me what chronic care management is.
Well, CCM stands for Chronic Care Management. It's a program at Family Practice Associates of Lexington that engages patients. We communicate with them once a month with one of our nurse care navigators. They work closely with the provider on the patient's chronic conditions. They become the main contact for the office. Our goal for this program is a team-based approach to health care to improve patients' outcomes and keeping them healthier longer.
Now, it's been going on for a few years.
Yes, we've had it going on at Family Practice since 2015. We've currently got 580 patients enrolled. 800 would be nice. 580 patients enrolled and have two nurse care navigators, Carissa and Tara.
And Carissa and Tara mostly do it on the phone, so they hear their voices. They don't often see them in person.
That is correct. It's done outside of a normal office visit. It's done via telephone.
All right, now, who can enroll in CCM? What kind of patient would be a candidate?
Patients with Medicare and Medicare Advantage that have two or more chronic conditions, such as hypertension, diabetes, hypertension, COPD, depression.
Okay. Now, there's some areas if they qualify, there's some areas of focus that you have in terms of keeping them healthy.
Yes, so our area of focus is keeping them healthier longer. Our main goal is having patient care plans and goals, making small goals so they can obtain those goals, reducing hospital admissions, readmissions, medication management, financial barriers. A lot of patients have financial barriers for medications, getting food and transportation, and getting them the community resources that they really need.
Now, you mentioned community resources. I know as a physician, I talk to patients and try to get them to enroll. That is, sometimes CCM is a real lifeline to them in terms of reaching out, talking to them, keeping them in touch, and maybe preventing a problem before it gets to be major.
Exactly, and a lot of patients don't know about those community resources that are available to them. We've partnered with the local health department, the Fayette County Health Department, for the free diabetes program. We've also partnered with the local Alzheimer's Association. They have fantastic resources for patients that a lot of patients and caregivers don't know about. Bluegrass Navigators and Commonwealth Home Health also have fantastic programs for patients with dementia that help them and the caregiver, and that's what's important.
And they can enroll after or during an office visit or by contacting Family Practice.
Yes, so to enroll in CCM, it is referred by the provider's, the patient's provider, or a staff member can recognize that they need to be enrolled into CCM.
All right, that's great. Now, part of CCM and population health, you may end up with what we call remote patient monitoring. Tell us what that is.
So remote patient monitoring, it's a program that allows us to capture and monitor the healthcare data of a patient while they're at home. So for example, if we're monitoring blood pressure on a patient, we give the patient a device, and when the patient utilizes that device, it transmits their blood pressure into our system. So we have that, and we're able to monitor that daily with their healthcare team so that they can make any necessary changes to their care plan.
Now, you mentioned blood pressure, but you do other things also.
Yeah, absolutely. Blood pressure, we do a lot of blood pressure. We do blood glucose monitoring. We do oxygen monitoring with SpO2 monitors. We do weight scales to monitor obesity and congestive heart failure. We also do temperature monitoring, where we can monitor a patient's temperature. So those are the primary things that we monitor.
So you get some of this information, and Shannon, your group at CCM might see, okay, this blood pressure is not controlled, so they can help handle that before it gets to be a problem.
Absolutely. So Visium helps us monitor that. We have a direct connection with our EMR and connection with our nurses, and they alert our nurses so that we can alert the physician on maybe changing the patient's medication if their blood pressure is high, so we can keep them out of the emergency room and keep them from being admitted to the hospital.
Well, and another thing too is to make sure they're taking their medicines.
Absolutely. It's the part of medication management, so reaching back out to them, did you take your medicine today? And a lot of times we find out that they didn't take it because they couldn't afford it. A lot of times patients don't let the providers know things that go on with their financial barriers, and they open up to the nurses and tell them things, and that's when we find out how we can get them help with affording the medication.
Okay. Now, with the remote patient monitoring, I know with CCM all you got to do is really have a telephone.
Mm-hmm.
Do you have to have internet or other services to do RPM?
Some devices you do, but with our devices primarily, they're cellular connected. So we give the device to the patient, and as long as they have a cellular connection, once they use that device, it automatically transmits in. So it makes it really easy for the patient to use that device, and they don't have to have internet, nor do they have to download an app or anything like that.
I know this is a general question for both of you, but Shannon, you can start. Is it covered by insurance, or does it depend on the plan?
It is covered by Medicare. It's typical for traditional Medicare. It's a copay anywhere from $7 to $12 a month. But patients with a secondary or an Advantage plan, it is covered in full for the CCM program.
How about RPM?
Same thing, it's covered by Medicare and many of the commercial payers as well. But it is covered if you have secondary insurance. It's typically no cost to the patient. If it is a cost to the patient, it's usually $15 to $20 per month for the entire program.
Okay, that's great information. Appreciate you all coming in, and thank you for the work you do.
Absolutely, thank you.
We'll be right back.